Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster, editor of Startup Health magazine, and I'm joined today by Murray Brozinsky, CEO of Conversa. Murray, thank you for joining me from your home, I assume, in California.
Yes, thank you, Logan. I'm here sheltering in place in San Francisco.
In San Francisco. All right. Well, I appreciate you taking the time. You and your family healthy and doing okay?
We are among the lucky ones, yes, and feeling quite grateful that we're in a position to help. So
Yeah.
thank you.
Awesome. Well, I was particularly excited to talk to you today about the work that Conversa is doing. We've done stories in the past about how Conversa works in the health system, and we're really going to be laser focused today on how you are reframing that around COVID-19. I wanted to start by reading to you a quote that you gave recently, where you said, "The pressing issue in this crisis is healthcare system capacity. Hospitals are becoming overwhelmed." So I want you to give me a quick 30-second to a minute review of what Conversa Health does and really explain to me about how you're tackling this capacity issue.
Sure. Yeah, again, thank you for having us. So Conversa is a virtual health platform. So we automate communication between care teams and patients to collect valuable information so that you can manage more patients at scale and really dive into those patients that need care with data earlier than you could have otherwise. And it has lots of benefits: better experience, lower costs, better outcomes, and lower burden on the healthcare system and the providers. And now, obviously, these systems are being overwhelmed, hence the capacity problem. And at least from my perspective, it looks like there are four initiatives in the world that are really addressing it well. One is, flattening the curve, as everyone's been talking about, so we can manage, the lower peaks. And that's all about everybody participating and socially isolating. The second are, people scrambling to develop vaccines, and there's some really great work going on there. Then there's people increasing physical capacity, so turning their factories to make ventilators and masks like Dyson and Tesla and GM. And one of our friends over at Prisma Health in South Carolina, who's developed the Vesper. It's a ventilator that now can, with an adapter, can treat up to 4 patients. So increasing physical capacity, which is great. And then I think the fourth category is increasing virtual capacity, and that's where we come in. So
Okay.
we're basically developing a suite of products that increase virtual capacity in a number of very specific ways, which I can go through.
Yeah, let's get as specific as we can. Let's say that I am a COVID-19 patient. I have the symptoms, and I am associated with one of the hospitals that you work with. Let's just say I know you have a partnership with Northwell in New York City, which we can get into a bit more later. So I'm in the system. I have the symptoms. How do I interact with Conversa?
Yeah, so we created a suite of 4 products. We picked 4 big areas based on feedback from our health system partners that they're struggling with right now. We actually, Northwell, as you mentioned, UCSF in San Francisco. Actually, you're in Baltimore. We work now with MedStar in Baltimore and DC area. So the one product is they're going out to their communities and patients with a screener triage program we developed that very quickly allows you, as a person who is worried, to go in and assess your exposure risk, your travel risk, and importantly, your symptoms. And it quickly determines, hey, you're not really likely to have the virus, so stay away from the system. It's being overwhelmed. And so we're
Sure.
keeping people away from the 5-hour wait lines on virtual visits and going in physically to the hospital where they're at risk of actually getting the virus that they likely don't have.
Sure.
And the flip side of that is accurately identifying those patients through that process, those people who potentially do have the virus, and really triaging them to the right local resource. So go to this telehealth visit, go to this tent in this parking lot, go to
Yeah.
this ED. So that's the first product. The second is for those that actually got tested and are positive, or negative, actually. So they get a test. Right now, the labs have to get back and try to call those patients and give the results, and it's
Sure.
difficult. That's getting clogged. So we have a program that's delivering lab results through a chat interface as well. And if you get a positive lab result, it tells you that and then gives you guidance as to what to do in your particular situation. And similarly with negative results. So we're delivering lab results back, completely automated with no friction. And then the third is you're either tested positive or you're awaiting a result, or you're negative, but maybe you're still at risk of getting it. So we're calling it the quarantine check. And so for the 14 days, it constantly reaches out to you, checks your symptoms, gives you guidance around stress and anxiety that you're probably feeling as you're going through this process. So that's the quarantine check. And then the fourth one is actually designed to address the providers themselves. So it's called the employee health check. And every day, healthcare workers and others who are going into these hospital facilities have to go through a screening every single morning at home, and they have to get a badge that clears them for work. They have to show it at the building, so it's tied to a security system, and it tells them you're cleared for work, or you're cleared for work but you need to wear a mask, or you're cleared to work but you can't work with immunocompromised patients. And for those that are not cleared, it gives them guidance on how to self-care, or provides guidance for them to call occupational health at their facilities.
Okay, so let's just walk through that symptom checker. It's a self-reported conversation with an AI chatbot where you're asking me about my symptoms, what I'm feeling. So if I'm a provider, I'm going through a series of questions on my smartphone and self-reporting how I feel. And that is how I come up with whether or not I can work that day, right?
Yeah, so it's exactly right. The nuance is, it's not just asking you how you feel, it's actually designed with a very, very nuanced algorithm that changes every single day. So we're working directly with the CDC through our partners at UCSF Health's Command Center, and all of our partners, their epidemiologists and clinicians are contributing. So this algorithm is being updated with the latest information from CDC and or WHO, and input from these epidemiologists that are watching what's actually relevant now to determine precisely whether or not you likely have the virus or not.
Got it. Got it. So what I want to switch gears slightly here, because there's been a lot of talk, a lot of energy in this idea of increasing capacity through symptom management, self-reporting of symptoms. But what makes Conversa unique, from my understanding, is that you're really rolling this out like right now. Like you're in the middle of implementations. It's not an idea. It's not in theory. You're in the middle of it with UCSF, with Northwell. So I wonder if we could sort of switch gears and talk about some things you're learning in the moment, because you're actually doing this with patients at scale.
Yeah, so just to give you an example, it's exactly right. So this has been out. Some of these programs have now been out for, uh, in the COVID world, this is 10 days ago, right? So these programs we rolled out very quickly.
Yeah.
So at UCSF, there's 5,000 employees a day that are using this program to
Wow.
determine where they can go to work, and it's going to be rolled out this week to 26,000, and then all the UCSF affiliates, and there's lots of other systems around the country that clamoring for this. The reason it happened in San Francisco first is the San Francisco Health Department mandated this. Now the state of Oregon has mandated it. So we're seeing these mandates go out by the state and local levels. And so that's driving a lot of requirements to systems like this in place. We've gotten inquiries from prison systems, from federal buildings. So anybody who is an essential service that is having people come into work. On the screener triage side, we've got some of our systems, MedStar and UNC and others, that are sending this out to millions of community members and patients. And what we're seeing there is around latest stats I've looked at this morning, 83% of people who are worried, they go through the process of taking the symptoms, are being triaged out of clicking on a free e-visit. So if you're worried, a free e-visit's at low friction, you're probably going to click on that. So you would expect everybody would do it. And that's why, there's 5, 6, 7 hour backups on telehealth. They can't keep up. So we're triaging away 83%. That's an enormous value. There are people that were worried, and now they're like, I don't really need to be worried. Of those that were flagging a red, you likely are at risk. Over 70% of those are actually going to that visit. So we're starting to see this triage really working and managing capacity. And then on the quarantine side, we just launched that with UNC Health in North Carolina, and others are going to be fast follow. And we've got thousands of patients now in quarantine that are checking their symptoms daily. I don't have data yet on the feedback from it because it's so early, but it's certainly working. And in New York, we've got thousands of people a day being delivered their lab results from Northwell through the program.
I'm glad you mentioned Northwell. Obviously, the eyes are on New York City right now, and Northwell is in the middle of that. And so, what are just some of the things you're seeing out of that partnership? Lessons learned early on. You said it's been 10 days that you've been rolled out. Responses from providers who are using the platform as a screener tool. What are you seeing in New York?
Yeah, New York is, as you mentioned, one of the hardest hit. Michael Dowling, the CEO of Northwell, is on the Capacity Council in New York. We're very close, working with them daily on, what their actual it's interesting. The different systems, based on where they are going through different phases. So Northwell went right to the lab result. We got a lot of people being tested. We're overwhelmed. We can't reach out to these patients. We want to be empathetic in providing results and guidance so that those that can be cared for at home are not overwhelming the hospital. So that was the first need. Now, of course, there's lots of patients that are being quarantined and they're worried, and how do they manage themselves through quarantine? So that's the next one. And Northwell, UCSF, a number of others that we've been working with, we were already implemented because we have longstanding partnerships. So the ability to stand them up quickly was very easy, and we know the providers well. So that was they quickly turned to us and said, what can we do for COVID? And we developed in concert with UCSF and Northwell these programs. Now we've got the second wave of folks that we haven't worked with previously. And so we've created these so they can get stood up in less than 48 hours. They don't need to be integrated into your EMR. Later on, we can, roll out actually the interesting thing is our core business of managing patients on these virtual platforms. Those are the patients that are at highest risk, right? So we're managing diabetic patients and respiratory care patients and heart failure patients and chronic kidney disease. So for those that we're already integrated with, we're seeing that those mission critical platforms are becoming more mission critical. For example, El Camino Hospital in San Francisco, their respiratory care patients for COPD and asthma and pneumonia can't come in for rehab. Mm-hmm. So we've quickly built a rehab module, and they're doing it now virtually through the program they were already on for their check-ins for COPD, for example. Mm-hmm. So for existing clients, we're actually ramping up what they've had in place. For new ones, we're starting with COVID, and then they want to fast follow with these other programs to get their high-risk populations on the platform. In fact, our new mantra, we talk about the quadruple aim of healthcare. Mm-hmm. We've added to it. These platforms are now being built, or what they're good at is helping patients and their providers stay connected without getting infected on both sides. Right? So virtual care is more and more critical. Everybody sees it in telehealth, but you also see telehealth is at full capacity. They can't handle it. So we're a front end to telehealth, right? There's a lot of things you can do virtually, asynchronously, without having a provider involved, and then only leverage the provider when absolutely necessary.
That's such an interesting theme that I've been seeing across these interviews is this this pivot, this focus, I should say, on asynchronous care, and how telemedicine is obviously having its moment, but at the end of the day, we still have to address the scalability problem of patient and provider one-on-one care in a in an exponentially growing pandemic situation. So the scale is such an issue.
Yeah, it's all about scale and capacity from our perspective, and it's not. To your point, we'll never replace the need for the one-on-one synchronous connection. The issue is, can you identify when that's really a need versus a nice to have, or versus a waste of time?
Yeah,
that's what it's being. A sharp light is now being shined on that, and it's actually a very small percentage where that's required. There are pregnant women, right? They would go in to see their doctor. It's nice to have that personal touch. Now you want to stay absolutely away unless you absolutely go in. So we have OBGYN programs where certainly women who are not having complications and they're early in their pregnancy, stay connected without getting infected is a mantra.
Got it. So this situation has been a spark. You say you're able to stand up a platform with a partner in 48 hours, and you're getting all this inbound interest. I'm curious, how do you see this leapfrogging us forward in a post-COVID world? You've got all these companies that maybe weren't thinking about this kind of chat-based communication. They weren't thinking about it before. Now they have. It's caused them to embrace it at scale, and then we get through this. What do things look like post-COVID then?
Yeah, I think we were kind of I don't think we were at a tipping point in virtual care, but I think we were at an inevitability point.
Okay.
The question there is, it's going to happen, but what's going to be the catalyst? How long will it take? And I think this is the catalyst. And I used to say virtual care is our future, and the future has just been pulled into the present. So what I'm seeing now, even in conversations when we get a call from a hospital we've never talked to before, what they're saying is, I need to get this up right now, but I recognize, as I just said, that we've got these vulnerable patients, and I need to, as quickly as possible, get them on a virtual care platform. So what we're actually doing with new hospitals now is they're actually subscribing to our platform, and then we're throwing in the COVID programs for free. So we're saying, join the company, become an existing customer, and then we'll throw whatever you need in any one of these 4 programs to address your issues that you're having now, and then we'll be there for you at at discounted price. You'll be a customer, and so we'll be there for you when you need to roll out your diabetes population or your COPD or heart failure population. So right now, people are expressing interest and saying, I'm very interested, but obviously right now my focal point, my acute issue is COVID. So we said we've got to address that. So let's do that for free right now.
Got it. So that's awesome. So you're rolling out the coronavirus chat feature for free. Since you've had some time and you've run a lot of people through the system, I wonder if you have any, lessons learned or sort of, myths that have been busted along the way, things that the rest of the market might not understand if they haven't had the volume that you've had.
Yeah, I'll tell you one thing, and it's interesting. I wouldn't. Some of them get it like that, and some of them still struggle. In healthcare, everything is slow. I mean, part of the reason it's very obvious that certain things should be happening in healthcare, and it's frustratingly slow for everybody involved. Just takes forever, and people overanalyze, and they're doing nothing, and then they want everything. Versus, hey, something's better than nothing. Let's take the first step.
Yeah.
I think a lot of that's changed. So we'll say to people, we know you want to change this algorithm and you want to tweak it a little bit from what UCSF is doing, and you want this to happen and that to happen. Okay, that's great. We can spend a month talking about it and it's going to cost a fortune. Or you can have this up, in some cases, 24 hours, or you can have it up. It's going to do 99% of what you need.
Yeah.
And by the way, we're going to manage and maintain it. And you can have your doctors providing input for the benefit of everyone. So this whole notion of how do you deal with something that's moving so rapidly, but keep it as evidence-based as possible? And you might have a little bit of a difference of opinion from the CDC. Is it worth maintaining your own system, taking another month to get out and spending a lot more money? So once people get through that conversation and they run around and talk to lots of people, we're finding people come back and they say, I need it now. I'll take that program. Let's get it up tomorrow.
Yeah, interesting. Well, I think that's an interesting note to end on. As a final note, what kind of partners are you hoping to hear from? Who are you trying to collaborate with right now? And what's the best way for them to reach out to you?
Yeah, so we've got reaching out, go right to the website. I mean, we're 24/7, so if people happen to have my number, call me directly or anybody at the company. We're working with any health systems that need to get out in their community and manage capacity and triage for patients and providers and community members. And then the other, that's our focal point, absolutely. I think the other folks that could be helpful are large payers. They just have, if payers can get out there and provide this out to their provider communities, we're providing it to payers for them to do that as well. So I would say large systems that are in the trenches dealing with it right now, and anybody that's trying to help those systems and providers deal with patients, we're happy to help.
Awesome. Well, Murray, it sounds like you've got your work cut out for you. I appreciate that you're out there in the market doing this work right in the middle of this. And I'll be excited to hear how this helps with capacity in coming weeks. So I hope you'll keep me updated.
Absolutely. Well, really appreciate you having me on. Thank you.
All
Stay
right.
safe.
You too.